Blood clots strike 900,000 people each year and kill 100,000, with half of them happening to patients in the hospital who are supposed to be getting preventative treatment, such as anti-clotting drugs, but often don't receive them. So how can you protect yourself and your loved ones? Joining us now is WSJ health reporter Laura Landro and Dr. Elliott Haut, Johns Hopkins Associate Professor of Surgery and Anesthesiology. Welcome to both of you. Laura, your Wall Street Journal story looked into what goes on in hospitals and why this happens. What did you find?
Well, almost everybody's at risk for a blood clot. If we sit here and keep our legs crossed for the next 4 hours, we could get one. But the big problem in hospitals is that you're immobile. You've had all kinds of invasive procedures. You may have had damage if you've had joint surgery. And so you're at risk of getting them. And often, as Dr. Haut's studies and others have found, the drugs to prevent them, for a number of complicated reasons, even though they may be prescribed by doctors, are not always administered by nurses for all kinds of interesting reasons.
So, Dr. Haut, how big of a problem is this for most hospitals?
So I think this is a huge deal. I mean, this is one of the main things that we know is important to do as far as patient safety, is to get the right medications to the right patient at the right time.
And so, Laura, what efforts have you found are being made to improve on this?
Well, things like what Dr. Haut is doing at Johns Hopkins, you really are doing basically quality improvement efforts. You are going into educating nurses. And by the way, patient refusal is huge. If a nurse says to you, oh, you've had enough shots, you don't need to get another one. I think in one of the studies, something like 60% of the patients who had preventable clots had refuse the drug. So they're going in and they're really trying to educate both the nurses and the patients. Because if the prescription doesn't get there, you're going to have a problem. So
that's very good advice. Dr. Haut, what additional advice do you have for patients? What should they be on the lookout for? What do they need to know?
I would tell you that we as physicians and nurses, we've come up with the best idea and best recommendation of what medications we should give you to help prevent these blood clots. We tailor the choice right to your condition, and we offer you the best suggested medications. And I would say, if we've done that, you should do your part and take those shots. We've found that a huge proportion of these missed doses are due to patient refusal, and we're working on educational tools so people can understand how big a problem it is and what we can do to prevent it.
Is there something else that patients should also be doing or being aware of? Moving around a lot, getting up and walking? What are some other things they should be doing?
So ambulation is it's certainly good care, and we certainly want people ambulating as much as possible, but there isn't any really strong data that ambulation alone prevents these blood clots, and that's actually one of the myths we've been trying to fight. At least for hospitalized patients.
Very interesting. So what about outside the hospital, Laura? I mean, we say that you and I just sitting here, we could get a blood clot.
Well, the classic is what they call coach class syndrome, the cramped in a long plane ride.
Right.
There are a lot of symptoms. There's some good stuff. The CDC website on blood clots, the National Blood Clot Alliance has a lot of information on the things you can do, what some of the signs and symptoms are. Like if you have unusual pain or redness or swelling in a leg, you might want to, kind of ask about that. We talked to one guy who had shortness of breath, and it was really bad, and he went to the hospital, and sure enough, he had blood clots in his lungs. So you have to really be alert to the signs and symptoms and some of the risks you might have, including different kinds of medical conditions. If you're on birth control drugs, you might be at risk, for example.
And so, Dr. Haut, is there a typical patient that you are more worried about who is at risk for getting blood clots?
The tough thing is, in the hospital, almost everybody's at high risk. Different people are at different risk levels, but we really have to consider this for almost everybody admitted. So it's not something that if you're a certain type of patient, you can just ignore. It's really for everybody in the hospital. It's a critically important thing to think about.
Even the youngest patients, even children?
We see many fewer clots in kids, but they certainly do happen, and we've got partners here working on the pediatric side to help prevent clots in the kids that are at highest risk.
All right, great information, Dr. Haut. Laura Landro, thank you so much to both of you for that.